And so the body is smart. We just have to remove interference. And hopefully, all chiropractors believe that. Our goal is to remove subluxation, which is bone on nerve. Once the pelvis is positioned, then it's easier on the mom and the baby as it's developing. So it's
That's
great for
fascinating.
infertility. It's great for my pregnant patients. They love it. My CA, Lindsay, her sister was, because Lindsay's been with me for a while, and her sister was pregnant. She's like, "You got to come in. You got to come in." And the sister was hesitant. And then when she came in, she's like, "Why did I fight this so long?" And I have that happen a lot. People are like, "Oh, once you go to the chiro, you always have to go," or they have all these myths that they've heard. And once they come in, they're like, "Oh my gosh, I wish I would have done this sooner."
Welcome back to the Healthy Habit Podcast, episode number 94, with our favorite chiropractor. She's back in the building here. Dr. Roxane Zamora is with us here, chiropractic physician here at Imagine Wellness Chiropractic Center at 822 East Union Hills Drive, Unit 22. That's 822 East Union Hills Drive in Phoenix, Unit number 22, Imagine Wellness Chiropractic Center. Dr. Roxane Zamora has been in practice in North Phoenix at the same location here at Union Hills for 14 years, 4 years. I've sent a lot of patients to her myself. Awesome chiropractic doctor. She provides chiropractic corrective care and car accident care for all ages. And here she is to share her wisdom with us here on the podcast. Thank you, Dr. Zamora, for coming back.
Hey, thank you. It's always a pleasure. I love working with other great docs, and you're valuable, and I appreciate you.
No,
And
thank
it's
you.
always with much respect when I come on your shows. I
Oh, that's
appreciate you.
very nice. Thank you so much. Well, we're blessed you get to come on and talk with us here. So, what does being a chiropractor mean to you? Like, what is that? We don't, not many health podcasts have chiropractors that come on that talk about the day to day and the field in general. So, we have a lot of chiropractors that
Yeah,
kind of switch to being preventative medicine kind of functional docs, but they don't. I
yeah,
want to really dive into that chiropractic aspect because it's so important for people. So, what does that mean to you being a
yeah.
chiropractic physician?
So my goal is to always look for subluxation. It's vertebral subluxation complex, but we shorten it to say subluxation. And that means any bone that's misaligned can put pressure on a nerve, and every nerve controls the function of the body. That's page 4 of Gray's Anatomy. So we all know that uh, uh, the nervous system controls the function of the organ,
Yeah.
and any interference on the nervous system, then disease builds. And that's why scoliosis is bad, because
You can,
we
I'm sure you
know
love this
if
right
the
here.
bone is misaligned.
Yeah.
I love it. And
Yeah.
I saw it right away. I was like, yeah. So you can see on those, like the nerves at the neck, if we have text neck, which it's called forward head posture, but if your head is going forward now, from us looking on our computers or on our phones, a feather's weight of pressure on that nerve that is attached to the heart and lungs, a feather's weight of pressure can decrease the function of the organ by 50% within minutes.
The organ that's
And
supplied by the
so,
nerve, the organ that's being supplied by that
yes,
nerve that we can see here in the photo. For the audio listeners in the background here,
yes,
I would suggest go to YouTube. In the background, you can see I have a poster up of
yes,
the autonomic nervous system, and we can see all the nerves being supplied to certain end organs. So good, that's interesting.
yes. And so the nerves in the base of the neck, they go to the heart and lungs. And that's why the body's so smart. If someone's having a heart attack, their arm goes down, their left arm, because those nerves will go to their heart and lungs. And so the body's smart. So it will stop the nerve supply to the arm so that it can send it all to the heart.
Wow.
And so the body is smart. We just have to remove interference. And hopefully, all chiropractors believe that. Our goal is to remove subluxation, which is bone on nerve, organ building disease. And then I take it to the next step and I do corrective care. So I always start with x-rays. As you see that poster from the side, the body has curves.
Yes.
So I check and analyze where are those curves for you, right? For anybody who comes in, a normal curve is 31 to 40 degrees. So I see, take the x-rays, analyze them. What is the curve? So what degree is your curve? And then I look at what phase of degeneration, because there's three phases. Phase one is you lose the structure, some kind of misalignment, right? It starts the subluxation there. Phase two, I say it's kind of like a toothache. So phase one is it's starting to be achy, it's starting to hurt. If you don't correct that, if you don't get a filling or have the dentist take x-rays and see what's going on, it'll degenerate.
Mm.
And that's what happens with the spine. So then phase two is the disc is degenerative. So someone has herniated disc, desiccated disc, anything going on with the disc, we would call it degenerative disc disease. That's phase two. And then arthritic spurs start to develop. Now somebody's starting to be more chronic. It doesn't go away as quick as it used to. It's lasting a lot longer. Now the organs are starting to be affected. People will get acid reflux or headaches or issues
Wow.
with fertility, those things. And it's starting to be more chronic. So that's, if we're using the tooth analogy, now it's getting to where it's a toothache and turning into a root canal, right? Now it's much deeper, more significant. And then
Wow.
phase three is where it fuses together. The disc fuses together and or the arthritic spurs keep growing until it fuses together. Now it's very painful and a lot longer for me to take care of um, in terms of correcting it. So we can heal the disc space. It's never going to be 100% normal. Um, can get enough disc space in there, it can take parts to heal.
Yeah.
So that's always my goal. I start with x-rays. What phase of degeneration? How's the structure look? What organs being affected? And then how do we correct that? And I put together a care plan.
Wow. Great answer to that. Remember, that was a question. What does being a
Oh,
chiropractor mean to you? So that was phenomenal. Thanks for that breakdown. So we were talking about what happens if someone's sitting too much, doc, at their job, or people that drive all day to and from work and then they come home and they sit. What's happening to this pelvic nerve down here that supplies the genitalia and the bladder and kidneys?
yeah, that area for women, it can cause issues with fertility, problems with your hormones, with your periods, ovaries. For men, it can cause ED issues, prostate issues. For everybody, bladder, ankles, knees, and feet. So it's always about healing that area. So sitting is like sugar to the teeth, right? Sitting is not great. For people that have this job, I recommend a wobble cushion. It's an inflatable disc, and you can get them fairly inexpensive, probably under $20 on Amazon.
Yeah.
So I would recommend sitting on that um, to help the disc and some of the axial pressure, which is top down, from the top down, that kind of pressure. So I would avoid sitting as much as you can,
Right.
get up and stretch, and then help the disc as much as possible. And so when you use the wobble cushion, that takes some of the pressure off until you can come in and get adjusted. And just use it every day, especially for people sitting a lot. Shift in proper alignment, then the woman's typically more able to get pregnant.
Wow.
And then house like once the pelvis is positioned, then it's easier on the mom and the baby as it's developing. So it's
That's
great for
fascinating.
infertility. It's great for my pregnant patients. They love it. My CA, Lindsay, her sister was because Lindsay's been with me for a while, and her sister was pregnant. She's like, "You got to come in. You got to come in." And the sister was hesitant. And then when she came in, she's like, why did I fight this so long? And I have that happen a lot. People are like, oh, once you go to the chiro, you always have to go, or they have all these myths that they've heard. And once they come in, they're like, oh my gosh, I wish I would have done this sooner. So
Wow.
yeah, definitely for low back for women, if you're having those issues, or men if they're having ED issues or prostate issues, I would have them come in, get their x-rays.
Right. And what are some of the first, so that's how you started then? Any new patients, you first start with x-rays?
Yeah, we do an exam and then their x-rays. And I do the x-rays here in house, so we're able to get the results. And then I don't adjust people on the first visit. And I try and tell everybody that on the phone and on our website, because I really do take time to analyze the x-rays, right? I really want to see how's the structure, what phase of degeneration. I take it really seriously and I want to give people the best care. I need time to evaluate those x-rays. And so that's kind of our process. They come in, get their exam, their x-rays. Um, if they're really in a significant pain, I can do some things. I have an artho stim or an activator to do a little bit of, give them a little bit of relief, or send them home with a wobble that we have here as well. Um, and then the next day we get them in for their report of findings, which I have a normal x-ray so that they can compare theirs to normal. They have a reference. And then we go over their care plan. How long does it take to correct it? What are our expectations? And then every 12 visits, we do a re-exam to check in with everybody. How is the body adapting?
Another x-ray?
And then we send them home with tractions to do as well.
Got
At
it.
the end, we take a post x-ray, yes. Because
Perfect.
clinically, I want to see the difference, right? And it's exciting for them because they feel different. And they're like, I don't know if it's just, in my head, but I feel so much better. I'm like, well, we're gonna find out. And then when we see it, it's really exciting. It's my
Wow.
favorite part.
And you show them that
Yeah.
before and after the first and second x-ray, right?
Yes. Yeah, we get to compare them side to side.
That's great. Yeah, perfect. And again, that's Imagine Wellness Chiropractic Center with
Yeah.
Dr. Roxane Zamora.